Good morning. Welcome. Thank you all for coming today. Today is indeed a very exciting day for Gundersen Health Systems, our patients, the communities that we serve, and our nearly 7,000 employees. After an intensive and deliberate review of internal candidates that started back in January of this year, our Board of Trustees has selected the next Chief Executive Officer of Gundersen Health System. The board's goal was to find a candidate who can help us fulfill our mission and commitment to the communities we serve while maintaining and building upon the organizational momentum and leadership that Gundersen enjoys today. The candidate must strategically lead and inspire our workforce to deliver health care at a lower cost while continually increasing quality. I am very pleased to announce that Dr. Scott Rathgaber has enthusiastically accepted the position of CEO of Gundersen Health System. And let me give you a few details about Scott. Dr. Rathgaber has been with the organization for 17 years and is a board-certified gastroenterologist. In addition to serving as section chief of our gastroenterology department from 2005 to 2011, Dr. Rathgaber served on the Gundersen Board of Governors from 2010 to 2012. He has served as medical vice president of Gundersen's hospital operations, neurosciences, general surgery, anesthesiology, emergency services, occupational health, and pharmacy. Now, before I hand the podium over to Dr. Rathgaber, I would like to take this time to express, on behalf of the Board of Trustees, and as a member of this community, heartfelt thanks to Dr. Jeff Thompson for almost 15 years of leadership as CEO of Gundersen Health System. His dedication is deeply felt, and his impact is apparent in every corner of this organization. Dr. Thompson's willingness to work with the board through the selection process has allowed us to thoughtfully and thoroughly review candidates and choose the right person for the job. It is my honor and privilege to introduce to you Dr. Scott Rathgaber.
Thank you, Brad, for the introduction. I want to thank the board for their confidence and Dr. Thompson for his leadership over many years, our staff for their dedication to our patients, and our community for continued support of Gundersen's mission. I'm humbled by this opportunity and excited about getting to work in my new role. But most importantly, I'm optimistic about our future as an organization. Next year will mark Gundersen's 125th year in this community. Through that time, we've had a handful of leaders who have shaped and transformed this organization from humble beginnings to its 3-state presence and national prominence. I have a lot to learn in the coming weeks and months, but there are 3 messages I want to highlight today that will guide my work. One for our patients, one for our community, and one for our staff. First, for our patients. Healthcare is a changing environment on a variety of fronts, but our mission remains clear. We will continue to give patients the world-class care that they request and they deserve. We will do so with compassion, integrity, respect, and innovation. Our job is to continue to drive down the cost and improve the quality of care. The second message for our community. Gundersen may be the area's largest employer, but we cannot improve the health and wellness of our community alone. New partnerships will be formed, and old partnerships will be strengthened to support education, research, and outreach for a better, healthier future for all. We look forward to your ideas and your support. Third, for our dedicated staff. You are Gundersen's best resource. You make the difference for better health and wellness every single day. A priority of mine over the coming weeks is to visit staff here in the immediate La Crosse area and in our great regional locations, asking for their ideas in making Gundersen an even better place to work and to provide care. Gundersen is well positioned to be a leader locally, regionally, and nationally for the next generation of healthcare. I am honored by the opportunity to lead this innovative community institution. Thank you for coming today, and I look forward to answering your questions.
Was this a position you had thought about in your career plans?
It was not early in my career plans to seek the CEO position. I've always wanted to start with taking great care of patients, and I found over the years that by learning more about leadership, I could take care of more patients by helping others do a better job. And so during my career here, I've been given lots of opportunities to improve my leadership skills. And as I broadened the number of folks that I had responsibility with, I found that it was exciting and exhilarating and really rewarding to see folks improve. So it was sort of a natural growth out of that. And once the position was opening, I thought it would be a good way to continue to broaden my skills and commitment to the organization.
Are you originally from the La Crosse area?
I'm not. I'm actually an Indiana Hoosier by birth. I grew up in New Haven, Indiana, which is a suburb of Fort Wayne in the northeastern part of Indiana. I spent my first 18 years there, but now I'm going on my 18th year here at Gundersen, and so it really feels like home to live in Wisconsin.
What drew you to Gundersen 18 years ago?
I was looking for a strong organization that was patient-centered and had a focus on high quality of care, as well as a multi-specialty group, because I really felt that was the future of medicine, to have a collaborative a group of physicians working together sort of under one roof. And this was a very desirable place when I came and interviewed, and I've never had a doubt since.